And we are live.
They've won Tonys and Oscars and Emmys and Grammys. There's no red carpet because they're home in their jammies. From Melrose Place to Broadway to Janeway and her crew. Let Seth and James bring all the stars to you.
Anywho.
They're entertaining everyone, so who's gonna grouse? Just sit right back and you'll hear some tales on Stars in the House.
So good. Hi, everyone. God, I hate the white background. It's so depressing. Hold on. Is there anything that makes it look nicer? Not really. It's me, Seth Rudetsky. By the way, I have a nice microphone. David, do you think I should use my nice microphone, or is this laptop okay? You can hear me? Should shrug? Okay. You know what? We didn't know if it was going to be James or me hosting. We knew it would only be one of us, and turns out I wound up pulling the short straw. No, the long straw. I'm happy to be here. Hi, Julia. Okay, so before we get into our medical questions, and we have plenty of them, I'll just give you a quick recap of what's been going on. You Stars in the House, folks. Let's see. I did a really fun kind of mini Red Bucket Follies. You know, Gypsy of the Year is now called Red Bucket. And Dr. LaPook would appreciate that. They thought it was too dangerous to do a Red Bucket this year because it'd be 300 people backstage, and it's just too hashtag super spreader. So we did this little mini version for the major donors of Broadway Cares Equity Fights AIDS. If you don't know, Red Bucket Follies is after 6 weeks of fundraising, you know, the red buckets that they do at the end of Broadway shows. And like Hugh Jackman, like, you know, auctions off his t-shirt. And did you hear that Nicole Kidman just bid $100,000 for, I don't even know what, like a handkerchief? So we raised all this money for Broadway Cares Equity Fights AIDS, which is not just for people suffering from HIV and AIDS. Also, they'll make like a $25,000 donation to like Puerto Rico after the hurricane or after Katrina. Like they're amazing, Broadway Cares, and Tom Viola is such a great leader. So after the 6 weeks of fundraising, there's this big show called the Red Bucket Follies, which is like a variety show with all these really fun things. And I usually host it, but didn't want to do it this year because super spreader. So we did this little mini event. It was me, this amazing dance troupe, and Jessica Vosk. I have one picture of me and Jessica singing. They called it a toast to you, because it was just for like the high donors of Broadway Cares and the angels. And that's Jessica Vosk. And we began with, thank you for being a friend. Oh. And she ended with, this is me. And I did my Osmond's Fiddler Deconstructing. That's the website for Broadway Cares. This is, I should have had it with me. This is the great month to go to BroadwayCares.org and get all your holiday gifts. They're all Broadway themed and they're amazing. The Carols for a Cure CDs, listen to my deconstruction of Shoshana Bean doing Dreidel Dreidel. Incredible. And the ornaments they have, you know, Glenn Hansen, who made this shirt, he makes all like my Brady Bunch shirt and everything. He's such a great artist. He makes these ornaments of Broadway stars as their character roles. So it's like Audrey McDonald as Lady Day, Angela Lansbury. Oh my God, there's Angela Lansbury's name. And there's Billy Porter as Lola in Kinky Boots. They're so nice. And you go to BroadwayCares.org to get them. And it's a great gift. And all the money goes to charity. Okay, so I started doing these shows at Cafe Carlisle. They never booked me there before. Suddenly I had these gigs there. It's so fun. So this month, they like, you have 3 shows. So I'm trying to think of something fun to do. So I'm doing a farewell to Phantom of the Opera. So I have 3 shows. Who's coming up? This is one that's coming up on Monday. It's Ali Ewald, who's Christine, Hugh Panero, who is Raoul and Phantom, and John Riddle. They're both almost sold out. That's Monday. And then the following Saturday is Aaron Olfstein, who is Carlotta, Gabe Willis, who is Christine, and Sean McLaughlin, who is Raoul. Raoul, I'm frightened. And Seattle Susie Q, who's always on the boards, was at the show. Now, you know what she looks like. What else I want to say? Oh, here's like a little clip. That's me and Howard and Emily and Rebecca Eichenberger. What else I want to tell you? Anything important to tell you? We saw opening night of A Beautiful Noise. We ran into Lauren Lataro, you know, the choreographer. That's us in the audience. Hey, Queens. That was the opening. It was super fancy. That's the Neil Diamond musical. Oh, and Dr. LaPook would appreciate it. I had my hernia operated on. You know, it's hard when someone doesn't tell me I have to get something done immediately. It's kind of hard for me. I'm like, fade out. So they were like, you have a hernia. You should get it done eventually. So I just kind of waited like 4 months. Hi, Seattle Susie Q. And finally, I was like, let me just get it the hell over with. So the magical story is, you know, you can't eat before surgery. My surgery wound up being really kind of late in the day, like 4 o'clock. So I just kept fantasizing about, oh my God, when I wake up, I'm going to have an amazing Levain cookie when I get back to the apartment. And I told the nurse that I cannot wait to get home and have my Levain cookie. And she was like, we just had a holiday party. She's like, not the biggest fan of Levain cookies. I'm like, you're not? So like, you can have mine. So she handed it to me and I was like, I'm going to take this home and heat it up. She's like, I already heated it up for you. She gave me a hot Levain cookie and James got the photo. It was a dream come true. I had to cover up my rack because it's PG-13. And into the Who, our total as of this viewing, by the way, I've never seen a more depressing background. I just can't take the white. Our total as of this, and this is the beautiful salad bowl that Ryan Rosenberg had made for us for our next, every time we do game night, we use this salad bowl. Our total, because the viewers like you, is, I was going to start from the boring part, $570, $1,173,570. $1,173,570. That money is going to the Entertainment Community Fund, pay for people's housing. Look, K-pop opened and it's closing in a week. It ain't a steady business, man. People had a Broadway show contract and now they don't. So people go to the Entertainment Community Fund to pay their rent, their medical bills, their insurance. So thank you for donating. If you'd like to donate tonight in honor of Dr. LaPook joining us with his busy CBS schedule and still answering our medical questions, please go to starsinthehouse.com. You could donate there. And then why don't you send us a little note? You go to donations. You send the email, donations@starsinthehouse.com. Jacqueline Yee is so kind. She always donates. She wrote, Dear Seth, James, and Dr. LaPook, I cannot express how much it means to me that you continue to be upfront in all the precautions you take on the show and in your daily lives. My family and I are often the only people masked wherever we go, masquerade, wherever we go, which is already very limited due to my compromised respiratory system. The pure pressure to act as though there is no longer any danger is getting harder and harder to bear with the grin, though bear it we must. That's from Jacqueline Yee. She donated. And someone just wrote, I can't believe, what did I say? I can't believe there's a resurgence in COVID after we've done everything from pretending it's over to pretending it never happened. That was hilarious. One more donation. Let me read. Of course, our loyal Isabel. Dr. LaPook, it's so nice to see you here again. Thank you for everything you're doing. And speaking of Dr. LaPook, make sure you follow him on Twitter and Instagram. Here he is, Dr. John LaPook.
I'm back.
And better than ever.
It's good to see you, Seth. It's good to be good. It's really good to be back.
I'm so glad to have you here. Can I just literally launch into questions that we have from our viewers?
Yeah, I mean, before you launch into the questions, I think sort of some backdrop should just be, especially since it's been so long since I've been on chatting with you, is just the very minor issue of how are we supposed to live our lives now? What is the approach? What is the philosophy? How do we think about it? We have the holidays. So I think that should be a theme for today. Just, what am I doing? What am I suggesting my patients do? What am I seeing going on? So anyway, you can ask specific questions, but I think that's the theme today.
I'm just posting that you're on so people know on Stars in the House.
Hello, JD.
Stars in the
Black Scrubs. Yeah, I was doing procedures this morning. I was doing a colonoscopy and an upper endoscopy. Everything turned out fine.
You're slightly a downer, but brava.
No. Let me phrase it differently. I did a procedure and found a polyp which potentially saved that person's life. How about that?
Yeah, when you get those polyps early, man, very exciting.
You pluck them out, and then instead of getting cancer potentially, you don't get cancer. Go out and get your colonoscopy if it's time.
Okay, maybe we're gonna work on the prep in the future. How we're gonna make that a little bit easier for us.
You know what? It's better and better and better the way they're doing it. Less and less volume. It's still not. That I used to say years ago, it beats chemo. It sounds a little cold to say that, but it does. I mean, it's one night of your life.
Yeah, it's just
clean out.
It's just the drinking of the gelatinous.
All right, we'll talk about this offline.
I have a lot of comments.
I'll give you all sorts of tricks about the prep.
Okay, here we go. This from Jacqueline, who I think actually just donated. We're talking about how did the severity of the current variants compare to the flu? It appears the death rate is still 3 times greater. Is that true?
Yeah, I mean, look, this is the death rate with it's hard. Those kind of comparisons are really tough to make. The death rate with flu is about 1 in 1,000, and it depends upon whether or not you're vaccinated. in terms of the death rate. I mean, one of the things that we've seen with these variants is they are still killing people, right? We had 250 deaths a day, down from 300. That's great, but it's great that it's down, but it's still 250 a day. So we're seeing that in people, mostly people who are, elderly, immunocompromised. But now, because so much of the country has had at least one vaccine, don't be faked out. Most of the deaths are actually now in people who have received vaccines. So
that's interesting.
They may, because so many people now have been vaccinated. But if you're out there and it's either been 3 months since you had COVID, or you have not had the updated and you have not had the updated bivalent Omicron vaccine, it's time to get that. I know that there's discussion about that, but it does. What we discovered from, we discovered that this was not like the measles vaccine. It doesn't totally prevent any obvious infection. People are still getting infected with COVID, right? Even though we all know tons of people been vaccinated, they get COVID. What it does is protect you from severe illness, from hospitalization and death, which is the thing that we want.
Let's say people got the vaccine and then they skip the early boosters. Are you supposed to get all the early boosters and then the bivalent, or can you just go right to the bivalent?
No, you go right to the bivalent. Okay. That's where we are right now. But it's tricky. I was looking this up this afternoon because the FDA just they just okayed the vaccines, the bivalent vaccines, Moderna and Pfizer, for younger kids. And it's tricky. You just have to look at it like, which one you're supposed to get when. So I think obviously your healthcare provider is going to know that, but it's nice that it's being approved for lower and lower.
That's great for parents, especially in this holiday season. Okay, I haven't even heard this. Is it true that Evusheld is not effective against the current COVID strain? And is it true that monoclonal
antibodies? So the monoclonal antibodies, the Evusheld, it was for people who were immunocompromised, and it would give you several months of protection. It was a type of a monoclonal antibody. No, they're not effective against the new strains. So, but there are effective medications. Obviously, Paxlovid is an effective medication, even though there's now a wrinkle with it, right? Which is the Paxlovid rebound. So people can take Paxlovid. You take it twice a day for 5 days is the prescription. And however, we're finding out that in a considerable number of people, the exact percentage is unclear, but it's a lot more than the 2% that Pfizer initially said. I mean, it seems to me and others that it's more like 20 to 40% or higher. We don't know the exact amount, but 3 to 8 days after you finish the course, you can get a rebound. You can get symptoms and test positive again. That generally lasts, anywhere from 2 to 6 days kind of thing. So now people are talking about, should it have been a longer course all along? And there's going to be a study where they compare 5 days to 10 days. But anyway, if you're at high risk, it's tricky, but it's recommended for people who are at high risk. And now what people have to think about is, it's this time of year, and if I get rebound, does that mean I'm going to be in isolation twice? So I think that's just the truth of what's going on now, and your doctor or your clinician is going to have to talk to you about that.
Should we all just have Paxlovid in our house so we can take it like as soon as
you can't? You're not allowed to have it unless your doctor has to say you tested positive.
Okay.
Because otherwise there's going to be a run on it, and we won't have enough Paxlovid. But by the way, I saw something that says that the government may stop paying for it in several months. So same thing with vaccines. They may stop paying for. I'm going to open the window because it's really warm.
Yeah, I know. It's wonderful global warming. This is kind of really obvious, but everyone's asking, but the holidays are coming up. So it's like, I mean, to me, you're going to say, what I would say is, if anyone's coming over to your house, have them rapid test the second they get there. I mean, is there anything different we should be doing?
All right, I'm going to close the window because it's now too noisy, because I'm hearing the subway or whatever.
I don't hear it. I don't hear anything, by the way.
Oh yeah, but I was hearing it. All right. So this is what I really wanted to talk about, actually, is philosophy, how you approach all this. First of all, it's the holiday season.
Mm-hmm.
And let's have a theoretical. Are you going to be visiting somebody over the holidays?
No, but I think we're gonna have friends come over to us for like game night.
Okay, so people are going to come over to your house for game night, and let's pretend that there was somebody in your house that was immunocompromised or particularly susceptible, vulnerable, over 65 or under 5, whatever. So, how do your friends think about it when they're coming over? Whenever. So, first of all, we have the trifecta, right? Of RSV, which is respiratory syncytial virus, which is surging. And especially in kids, you're seeing a lot of hospitalizations. You're seeing flu, which is it's like doubled in the last week. It's a much earlier and stronger season than in like a decade. And then we have COVID. So they're calling it it's the trifecta or the what is it called? The tridemic.
Yeah.
Tridemic, right. So what have we been talking about for the past 2 years, right? Which is it's in the air.
Yes.
All right.
We're going to get one.
So the first of all, just remember that these are respiratory viruses. They're in the air. Okay. Yes, you want to wash your hands, but really the way we predominantly get it is by getting in the air. All right. So the incubation period of all 3 of those is generally less than a week. What that means is if you know you're going to go visit somebody for 1 to 2 weeks before you're going to do that, just be especially careful. At this time, all of our audience knows what that means. It means, if you are out in public and if you're, we all decide, do we want to go back to our normal lives? Maybe for the 1 or 2 weeks, you don't go eat at an indoor restaurant.
Yeah.
Maybe for the week or 2 before, if you're flying, you certainly wear a mask in the airport and when you're boarding and when you're deplaning, as if deplaning is a word. But when you're standing there shoulder to shoulder with other people, put the mask on. When you're in the plane where ventilation and filtration is better, people make their decisions on their own. I still wear the mask because it's a KN95 is more comfortable than an N95 for me. I'm actually just wearing the KN95 and it's perfectly fine. So you do everything you can to minimize your exposure for a week or 2. I don't think that's asking too much if you're going to be visiting your grandma or somebody like that. Now you wake up the day of the big event. You're feeling lousy. You have upper respiratory symptoms. Now there are 3 things that we're worried about, right? RSV, flu, and COVID. There's a home COVID test you can take. We all know that. There is no home FDA approved rapid test for RSV or flu. So for those, you have to go to a healthcare facility, but you can take the Binax or whatever your rapid test is. If it's negative and you have symptoms, remember it could be a false negative, right? So if it's positive, you're staying home for sure, right? If it's negative and you have symptoms and you're about to go visit a place where there are a lot of people or vulnerable people, I think it's very reasonable to go to a health facility, whether it's a rapid evaluation unit or even a hospital or your doctor's office, where they can test you for RSV, flu, COVID. And there's also this big panel where you can test for a bunch of other things, para-influenza virus and adenovirus. And because a lot of people test negative for all 3, but they're still sick because it's, there are tons of other viruses. So, okay, let's say and then I think if you're sick, and the reason to know that is that there's treatment. If you have the flu, there's treatment for the flu. If there's COVID, there's treatment for COVID. RSV, there's not. There's no specific treatment. So if you're a parent of a young kid, the main risk, as we know, or even older, is respiratory problems because their passage with their breathing tubes are so small, they get clogged with mucus and it's really hard for them to breathe. So you look for evidence that they're having trouble breathing. What's that? Like, for example, they have retractions of the muscles of their chest, like the muscles go in because they're trying, and the muscles of the neck go in, and you can see that they're really working hard. If there's any, change in mental status, grayness, any of that, you go to a healthcare facility because they may need respiratory support and even hospitalization. So now we're still on the way to your house, but if you're sick, you're staying home. You don't want to give you the holiday gift of a virus. You're feeling well. You go into your house. as close to, I think you're exactly right, as close to walking in the door as possible, you do a rapid test. Now, I understand that they cost money, they may not be available for everybody, but if you have access to it, I think that's a really good thing to do. Is it perfect? No, but it's probably going to be good for the length of the party. Okay, you may turn positive. We all know people who tested negative and then 6 hours later they were positive. So now you walk in and there's a room full of people and you're having an anxiety attack because, oh my gosh, everybody is in each other's face. And what happens when you drink? You talk louder. And the more people in the room, you have to talk over everybody else. Not only do you talk louder, but you get closer. So now I'm really getting those aerosols in your face. So obviously you want to do the ventilation thing. You're going to open the window. You're going to crack the door. If you have one of these home ventilation things, we know that the Corsi Rosenthal box that we've demonstrated before, you can make it for less than $100 so you can really clean the air. So no matter what the virus is, you're cleaning it, you're sucking it out. Now you're left with, I'm still anxious. I'm in this room. Now you get down to what's going on right now psychologically, which is at the beginning, there was shaming of people who didn't wear masks. Now there's kind of shaming a little bit of people who wear masks that I'm seeing. So everybody's got to be free to, you do you. So if you find yourself in the middle of that party and you're getting anxious, put on a mask. Put on a mask. And the same thing for the person who's the most vulnerable. I would say that person should put on a mask. One-way masking does work, not perfectly, but it works. So that's kind of like the big picture of what I would do to try to stay safe on the holidays.
So I feel as a host, you're allowed to say, by the way, we're testing you when you get here. Either
you can, yes.
Right.
I think as a guest, you have every right now to say, what's the COVID protocol? So that brings us to where we are now. So we're seeing a 25% increase in COVID in the New York metropolitan, across the country, actually, in hospitalizations and cases. We're now a hot area in Brooklyn and Queens. We've gone to hot, masking suggested. You should think about, go to the cdc.gov /COVID. And then you go down on the left-hand side of the screen, it says your community. Find out what's going on in your community. It's like a weather report. Is it raining? If it's raining and it's a storm, wear a raincoat and an umbrella. That means a mask and just being careful. If it's not, if you're at a low-risk place right now, you make the decision for your life, because we all have to go on with our life, that, I'm going to take a chance. I'm going to go to a restaurant indoors because, after all, this is going on and on and on. Anyway, that's kind of the way I'm thinking about it. And I think that the other thing is that psychologically right now, we need to realize that this has been a really tough, almost 3 years. And, people haven't hugged each other. I saw somebody tweet the other day, a woman in her 20s, who I happened to have interviewed because she had cancer that she beat. It looks like she beat. But I was following her and she said, I forgot how to hug. Do you do one on the top and one on the bottom, or one on the, it's been so long since a lot of people have hugged first, for lots of reasons. And I think, when you hug somebody and you look somebody in the eye, your endorphins go up, your oxytocin goes up. That's the feel-good hormone. Do you know that humans can look at dogs and both oxytocin will go up? I think it's the only species that's true for. So, it's been a rough couple of years. If you're a kid, it's been a super rough period. ACEs, adverse childhood experiences, they've been indoors. You have a generation of kids starting out with that. And then I think for my patients who are coming in, because I do a lot of internal medicine, I've just felt depression and anxiety have been really, pretty high. And I think it kind of sneaks up on everybody that they don't quite realize it's happening. And I think if everybody takes a deep breath now and says, let's give ourselves a break. I don't know if you're feeling, if you have felt that, Seth, have you?
I mean, first of all, I never like hugging because it's fear of intimacy. So I don't miss it at all. Keep it the hell away from me. But I have to say, wearing a mask has been, like, when I wear it, I do feel like, oh my God, I'm going crazy. Like, I do feel like the heat on my face. And I'm just like, I'll be in a car. I'm like, I'll just open up the window. So that's where I feel like I'm having a breakdown.
Otherwise, are you serious about the hugging?
I'm not a hugger, dear. Stay away from me.
So you know something? This idea. I didn't come up with it, but I think it's a good idea between Me Too movement and the pandemic. A bracelet that's either green, yellow, or red. And green is come on in and hug, and red is don't come near me, and yellow is I'm going to decide on a one-on-one basis.
Mine is
I
green.
think
Green
it's
for
tough.
doggies. I will hug every dog I see. I have no boundaries with dogs. I have a couple of pending lawsuits from dogs towards me. Okay, so
Any restraining orders?
A couple from like 2 Great Danes. Okay, someone's asking about these air purifiers. Should they be placed in your dining tables? I mean, obviously, the more you have, the better. If you have one, right?
I will tell you that we had this episode where we got together with a family, and my father-in-law, half of us got half of the people got COVID. My father-in-law was sitting. I put him in the living room right next to one of these high power air filters, and he didn't get COVID. In that time, and half of the people did. Look, it's in the air. It's in the air. And just to repeat for anybody who's not listened, the aerosol scientists have taught us. Not everybody in the medical community has accepted it still, but now finally the CDC is now saying it as the party line. It's spread in the air, and it can float across a room and over time accumulate, especially if there's inadequate ventilation, and eventually cause an infection even on the other side of the room. Think cigarette smoke. If you're smoking and somebody's on the other side of the room, can they smell you? Yes, they can. So whatever you would do to decrease the risk of inhaling that person's cigarette smoke, open a window, crack a door, get the ventilation up, get a air filter. Yeah.
I was going to tweet Dr. Kim Prather because she's obsessed with COVID is airborne and all the idiot precautions. And I was just recently at our vet. Nobody was wearing a mask. But when I signed my bill, I had to take my pen out of the non-used pens and put it in the used pens. I was like, nobody's wearing a mask. I'm not going to get COVID from this pen. Like, I don't understand why people are so stuck in the first month of the pandemic. When my dog is getting upset. It's okay, Mandy. Why are they still stuck in the first month when people still think that it's caused by touching newspapers?
So hopefully you're exactly right. And it's frustrating for a lot of people. It's been a horrible pandemic, but especially this audience, team stars in the house. We know a lot, right? We know how it's spread. We know how it's not spread. Yes, at the beginning, we were measuring how long it was staying on surfaces, and theoretically it could stay there for a couple of days, and we don't know how infectious it was. Your hands could be covered with COVID. If you don't put it above your neck, you're not getting COVID. It's going to go in through your mouth, your nose, your eyes. That's it. So, that's the hand washing. But the most way that you get it is not by somebody spitting on a table and then you a day later touching the table and putting it in your eye. You're in a room and it's in the air.
Okay, I have another. Why is my alarm going off? Oh, that's why my alarm didn't go off this morning. I set it for 8:30 p.m. Now I was like, why did it go off this morning? Okay, wait, I have a question about that though. Wait, you're talking about the annoying pens. So, yeah, because it's a Broadway audience. Someone was saying, what about seeing Broadway shows? Because there are no more masks in the audience. James and I went to the opening night of Neil Diamond, and we're like, 10% of the people are masked. So, what's your feeling about seeing Broadway shows, big theaters with a lot of people with no masks?
I've done it. I saw the Mike Birbiglia show. The old man in the pool. And I've seen Into the Woods. I'm going to be seeing the piano lesson this Saturday. And I wear a good mask and I feel fine. Don't forget, for me, it's different, right? Because I was on the COVID wards at NYU Langone Health, where I'm a professor of medicine, in April of 2020. It was everywhere. We had no idea. I was wearing an N95. People were coughing in my face, like right up to me, coughing in my face. I did not get COVID. Okay, I had a face shield, but that's not perfect for aerosol, right? Because it's just covering for direct spit. Mm-hmm. I had been in numerous situations where other people got infected, and I've been in a big place, and and didn't get it. I finally did get COVID for the first time in October because I went indoors without a mask. And, that's how you get it.
And you use one of those pens that someone else used.
Yeah, that was the thing.
That's what did it, you idiot.
No, you're in a room with a ton of people and they're not wearing a mask and you're not wearing a mask.
I think what people like, just before we go, like, it's a lot of people going, what does it matter? Everyone's going to get it anyway. Just get it over with. But I don't know if you know the story, Dr. LaPook, but I have a friend that's a dancer and he got a mild case of COVID 2 months ago. And 3 weeks later, he was like riddled with blood clots all through his body. And it was a mild case. And they basically said you would have croaked if you weren't in such good shape from being a dancer. So the bad part is it's not like the flu because you don't know what the hell it does to you.
Yeah, we're still learning about that. And you're exactly right. Obviously, we all know that there's this thing called long COVID, which is people having symptoms many, many months after the initial illness, even if the initial illness is mild. Now, we're still looking to see, to what extent the vaccinations decrease it. It looks like it probably decreases by about a half at least. Paxlovid may bring it down about a quarter. Maybe if it's longer, it'll bring it down more, because it seems to be related to the viral load. The higher the viral load initially, the higher your odds of long COVID. But this is no joke. This is not just the flu. It still has many more manifestations, complications, clots. It attacks blood vessels. It can attack almost any organ. It makes people. It brings people down. In addition to everything else, that they're tired more. I really think there may be a direct psychological effect. We certainly know that there is effects on the brain. And it turns out that the more times you get infected, the higher your chances of getting long-term, sequelae. So you don't want to have a million different infections. Yeah.
I kept going like, oh, once you've had it once, it'll always be that same severity.
No, but the thing is that let's end on a good long-term thought. When I was interviewing for the 60-minute piece about variants, I interviewed Paul Dupre from University of Pittsburgh, and he's from Northern Ireland. And I said, could it be, there are 7 coronaviruses, and 4 of them cause, one SARS-1, one SARS-2, right? The other is MERS, this, Middle Eastern. But 4 of them cause the common cold. 4 of the coronaviruses, which is what COVID-19 is caused by, cause the common cold. And I said, could it be that when they first came on infected humans 1,000 years ago or 100, whenever it was, that they started out as viciously as we're seeing COVID start off? And I won't attempt to do his very cute Northern Ireland, but he said, yeah, you're seeing the beginning of the movie now. He said, like, that was the end of the movie. The end of the movie is the common cold. The beginning of the movie is it's just starting and nobody has any immunity to it. But now we have hundreds, billions of people who have immunity to it. It is, in general, I think we were all noticing people who were vaccinated or they've had previous, it tends to be milder. When I got it, it was basically mild, relatively mild cold symptoms, as you're hearing most people. There was a Saturday Night Live skit. Did you see that about, ask your doctor about COVID? Because which it was funny, but it was like not funny because it gave the wrong message. But it was basically everybody saying, oh, it's just a cold and I get to be home for 2 weeks or whatever. But the truth is, you don't want to get COVID because it does cause side effects, and also it screws up your next 2 weeks, right? As you're in isolation, and then maybe you're going to get rebound if you're on Paxlovid. So let me finish with the up thought that over time this should be more and more immunity in the population. They are getting better and better vaccines. There's going to be a whole new generation of vaccines that are going to protect us. It'll be combined with the flu shot probably, and I think we'll be able to get on with our lives. But when you look at the numbers, we're still having these. We're in it right now. This is the worst time of the year generally because it's we're inside. It's cold. The virus likes cold and dry. We're inside. We're fed up. We're taking off our masks, we're set up for it. And we're doing traveling and all that. But I think if you take the the simple steps that I said, you can at least, you're not going to be 100% protected, but you can be relatively protected. And you certainly, I think, can create pockets of protection for yourself where you say, okay, I want to live my life. I'm going to take a risk, but for the next 2 weeks, it's a really special time. It's the holidays. I'm going on a trip. I'm going to be extra specially careful.
And please wear the mask that actually closed. You know, I went to get my hernia surgery. They're like, here's a mask for you. And it was the blue that had all the openings on the side. I was like, do you not watch Dr. LaPook?
Well, you know what's terrible is that some places forbid you from wearing the better mask. I'm like, are you kidding? Why don't you just take me out into the parking lot and shoot me?
Yeah, they were like, you need to wear this. I was like, I'm not wearing it.
It's like, yeah.
Okay, we have 2 more donations. Let me read them. Countdown, this is from Scott in Kansas City. Countdown to me being back in New York City 1 week. Always happy to donate to the Amazing Entertainment Community Fund and thankful and sending love to Seth, James, and Dr. LaPook. And everyone who starts in the house with the continuing love, laughs, entertainment, information, and insight. As always, love to the Sith Core fam as well. That's from Scott in Kansas City. And the final one, Seattle Susie Q, a.k.a. Susan. It's so nice to see Dr. LaPook again, donating in his honor. Also donating for everything Seth and James do. Love the Phantom Farewell, Captain Carlisle. Thank you last Monday. Look forward to seeing Seth and Ramin in February. Where am I going to be? Oh, I think Scottsdale and Florida, maybe. Happy holidays to you all, including the Sith Core fam. Thank you, Dr. LaPook. Thank you.
I want to make sure people know, get the flu shot if you haven't gotten it. If it's been 3 months since you had COVID, or you haven't had the bivalent vaccine, then go ahead and get it. I mean, you know, I think it's going to give you extra protection, and you might as well get it. We have a very low uptake nationally on that, you know, you shouldn't just rely on the previous vaccinations. You might as well. And not every doctor is saying this, okay, but I think, you know, for me, you might as well. There's really no downside. You've had the other stuff. There's some people saying, well, if you're at low risk, you know, you really be fine in terms of outcome. But I think there's a lot we don't know still about the risk of complications and long COVID. Why not have as much protection as you can? And finally, I'm going to Broadway this Saturday. I've got no problem. I'm wearing the mask. And, you know, that's my advice. If anybody says, what am I doing? I am giving my regards personally, in person, to Broadway.
Or as my mother says, Broadway.
Broadway.
Thank you. Thank you, David Katz. Thank you, everybody, for asking questions. See you all at our probably next Monday. It starts in the house, one of those days. All right, talk to you later. There's my alarm. Okay, that's got to stop. Should I sign off? How do I do that? I have to push the closing credits. David will do it. Bye.